it maybe shocks some people that they'd say we're focused not on the pandemic so much, but the idea that we're going to deal with it. We're going to learn to live with it. The vice president now has been exposed, and so it obviously spreads. So much talk about surging cases in the U.S. What about deaths? Are they also surging? What about the fact that the president keeps saying we're doing a lot more testing? Of course, we're going to uncover more people who've been infected. What do you think is the most important part of that story?
The number of deaths and the number of hospitalizations follow the number of cases. It's absolutely true that we're finding more people who have the infection because we're doing more testing. So that is a true statement. But it's not that we have more cases. It's just that we're aware of them. And we do know that the number of people who are going to be hospitalized and who are eventually going to die from this go up in proportion to the number of cases that we have. When you're looking at the daily death counts across the United States, we're seeing record numbers of increases. They're up 33% in Iowa, up 20% in Texas, up almost 20% in Virginia, up 17% in Montana. The numbers are not small when we're talking about deaths. They're not yet to those terrifying rates that we saw in the early days in New York City when everyone had no idea what to do. We didn't have enough PPE. They didn't know how to treat these patients. We're much better off in that circumstance, and it's spread across the entire country. You have to remember that. But the fact that this is happening in October and they're expecting it to really peak in the coldest of the winter is a very bad sign.
Michelle, the second worst coronavirus-affected country is, of course, India. We've now got a number of high-profile public officials testing positive, including the governor of the RBI. What do we know?
Yeah, they're having the same experience that we are in the rest of the world. And what's happening there now is that it's well-seeded across the entire country. So when you're seeing these increasing rates, you're seeing it from an already high level. So the risk to everybody across all levels of the government, of entertainment and arts, from the richest to the poorest, is in fact a significant issue. In some places, interestingly, in India, where some of these slums where people have live very closely to each other, they're actually already starting to hit some pretty high levels of previous infection. So ironically, some areas of India might reach a herd immunity level that's going to start offering them some protection before some of the other places where there has been a little bit more control of the virus.